Hello everyone, welcome back to my YouTube channel. Today we are going to talk about anterior triangle of neck. We will start our topic with introduction as usual. The anterior triangle of neck is a key anatomical region that contains vital muscular, vascular and neurological structure. It serves as an essential landmark for clinical examination, surgical intervention and anatomical studies. This triangular space is located in front of sternocleidomastoid muscle as you can see in diagram there. It forms a structural framework for several physiological functions including swallowing, respiration and circulation. And that's the reason anterior triangle is really important to study. Now let's talk about boundaries of anterior triangle. That is very important question for your exam, so you need to understand this. So the boundaries of anterior triangle are three boundaries. First is superior boundary, that is by inferior border of the mandible. Second is lateral boundary, that is by anterior border of sternocleidomastoid muscle, and then we have is medial boundary, that is by the midline of neck. This triangle is further divided into four smaller compartments, each containing important anatomical elements. And its subdivision includes submental triangle, submandibular triangle, carotid triangle, and muscular triangle. Now let's talk about them one by one. First we have a submental triangle that is situated beneath the chin. It forms the middle line portion of the anterior triangle. It contains submental lymph nodes which drain lymph from the anterior floor of the mouth. Second subdivision of anterior triangle is submandibular triangle that is located between the mandible and digastric muscles, and it forms a paired compartment on either side of neck. It houses the submandibular salivary gland, facial artery and lymph nodes. It is clinically important for evaluating glandular infections or tumors. The third subdivision of anterior triangle is carotid triangle, that is the most significant triangle for vascular and neurological assessment. It contains major blood vessels including the common carotid artery, internal jugular vein and vagus nerve, that is cranial nerve number 10. It is used as a landmark for pulse examination, carotid searches and neurological evaluation. The fourth subdivision of anterior triangle of neck is muscular triangle that is positioned over the infrahyoid muscle, thyroid gland, trachea and larynx. It is significant in respiration, endocrine function and voice production because of the structure it has. Now let's talk about clinical significance of anterior triangle. The first significance is surgical and diagnostic application. As carotid triangle is frequently accessed in vascular surgeries including carotid and arterectomy removal, that is removal of artery blockage. The submandibular triangle is examined for swelling, tumor or gland infection, and the muscular triangle is the reference point for tracheostomy procedures and airway management, and that's how it helps in surgical and diagnostic application. Further talking about clinical significance, they also help in trauma and injury considerations, as injuries to the carotid sheath can result in life-threatening bleeding or nerve damage. Lymph nodes within the anterior triangle are assessed for signs of infection or metastasis in cancer. And the third significance is that it has landmark for physical examination, as physicians palpate the carotid triangle to assess blood flow and arterial pressure, and also the lymph node assessment within the submental and submandibular triangle assists in detecting infection. Further talking about clinical significance of anterior triangle, it has a role in circulation and respiration, as the anterior triangle houses major arteries and veins that ensure efficient blood flow to the brain and facial structure, and the trachea and larynx enclosed within the muscular triangle facilitate breathing and voice production. Next is contribution to swelling and glandular function. The thyroid gland within the muscular triangle regulates metabolism, and the submandibular gland within the submandibular triangle contributes to saliva production, aiding in digestion. Next, we will talk about the conclusion of our lecture video. So, the anterior triangle of neck is clinically significant region that plays a vital role in vascular supply, respiratory function, neurological control, and surgical intervention. Understanding its anatomical layout aids in diagnosing disease, managing trauma, and performing medical procedure. And this was all about anterior triangle of neck. Hopefully, you like the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.